Welcome back to Newsday. The decomposing body of a young man was retrieved from the Obalinde Underbridge Canal in Lagos Island late January, 3 days after he was declared missing. The victim was identified as one of the miscreants who indulged in drug deals in the area and was suspected of being under the influence of illicit drugs before the incident occurred. The search team recovered the body from the canal. Officials of the Lagos Environmental Sanitation Corps, known as Kick Against Indiscipline, were contacted and conveyed the remains to the mortuary at Lagos General Hospital. A Lagos official who spoke on condition of anonymity said the victim was likely high on cannabis and slipped into the canal unnoticed. He had been living under the bridge for several years. The official noted that nobody immediately noticed he was missing, and the body was only discovered 3 days later by a search party. According to the 2025 World Drug Report released by the United Nations Office on Drugs and Crime, Nigeria's drug use rate has soared to 14.4%. That's nearly 3 times the global average, with over 3 million Nigerians currently living with drug use disorders. And joining us now for an assessment of the endemic crisis of drug abuse among Nigerians with a view to seeking practical solutions to the challenges, the Director of Media and Advocacy at the National Drug Law Enforcement Agency, NDLEA, Femi Babafemi, joins us now. Good afternoon.
Good afternoon. It's my pleasure being here.
Very good. So, what is your perception of the views in some quarters that there is a high prevalence of drugs and, of course, substance abuse in Lagos State, you think?
Absolutely. There is no need living in denial that we have a problem or a challenge of substance abuse in the country, and that was long confirmed by the 2018 drug use survey report, which actually painted a very grim picture of what the drug use situation in Nigeria was and still is. We're talking about 7 years ago. That was when that report was published. The situation could have gone either way by now. But then the good thing is government has since been very committed to fighting this scourge headlong, whether in the area of drug demand reduction or in the area of drug supply reduction. When I talk of drug demand reduction, that is where that is the leading agency in this regard. That's the National Drug Law Enforcement Agency, is leading the advocacy to sensitize the public, to raise awareness through our war against drug abuse, WADA social advocacy initiative, through which we go into schools, marketplaces, motor parks, worship centers and communities deep inside, working with faith-based organizations, community-based organizations, non-governmental organizations, and civil society organizations to ensure that we raise awareness aimed at preventing people so that people can understand and realize the danger of getting or indulging in illicit substance, in substance abuse, as well as the consequences. And very unfortunate, the report you read earlier painted or gave us a picture of one of those consequences. If one does not get out of it, if it is not stopped, or if one goes into it, by the time you go deep into that, one of the consequences is likely death, and which was very unfortunate in the case of the young man you painted. You reported earlier. So that is that. That's in the area of drug demand reduction, sensitization aimed at raising awareness and preventing people from going into substance abuse. And then another thing in that regard is providing support to those who may have gone into substance abuse. Because if you look at that same 2018 drug use report in Nigeria, which put the figure of those who had abused illicit substances other than tobacco and alcohol the previous year at 14.3 million. Those are people aged between 15 and 64. You will discover that if we put our population at, say, like 200, that's, 14.3 million, about 15 million, meaning that majority we still have majority not indulging in these things. So we have that responsibility to ensure that these people don't fall into the bracket of those abusing illicit substances. And for those that are already abusing, again, I can also tell you that the NDLA has been very much involved in the process of providing support, rehabilitation to these people. And that's why we have 30 treatment and counseling centers across the country today. And by the grace of God, with the support of the federal government coming from the president of the Federal Republic, we will be having additional 7 by the grace of God this year, this budget year. That's to ensure that we cater for these people, especially those that are willing and ready to be
Mr.
treated
Babafemi
and rehabilitated. In addition,
Mr.
yes,
Babafemi, I'd like to come in here. I know you'd like to talk about all of those initiatives that you've embarked on. Of course, you will talk more about that. But this is a very disturbing report. That's the 2025 World Drug Report, saying that the Nigeria's drug use rate has soared to 14.4%. That's nearly 3 times the global average, with over 3 million Nigerians currently living with drug use disorders. I'd like you to talk more on your assessment of the recent drug awareness that was embarked upon on the menace of illicit drug and substance abuse that was organized by the Ministry of Transport through the SSA on Transport and Logistics.
Absolutely. That was an awesome initiative by the Lagos State government. In fact, this was well commended by the Chairman Chief Executive of NDLA, General Mawa, and that's exactly what we are mobilizing the people to do. We are mobilizing sub-nationals, state governments, local government, all the stakeholders. The approach is a whole of society approach to get everybody to buy into this and do the same thing. We're commending and recommending this to other states. We're glad that Lagos State is doing this. That's a very good way to set the pace in this regard. That is getting people, mobilizing people to get their buy-in, to take ownership of this. That's what our WADA initiative, social advocacy initiative, is all about. Mobilizing everybody so that all the stakeholders, we all have our own sphere of influence. Everybody can buy in and take ownership of this whole effort. And we're very glad that Governor Babajide Sanwo-Olu has taken that initiative through the office of his Senior Special Assistant on transport, I think. That's Hassan. Sorry, I may not remember. I think Hassan Adebayo. That's an awesome job. The young man is doing there through with the support of the state governor. And that's exactly what we're pushing and recommending to other stakeholders, other state government, local government to also do. And we're glad that indeed some states also, for instance, we have the issue of drug integrity test, which is also part of what this campaign by the Lagos State government. The Lagos State government is organizing through the partnership with the NDLA, 10,000 drug tests for drivers alone. So this is all of this. They are all aimed at ensuring that we cut down on the demand for illicit substances, and we're glad that is happening in Lagos. And we're also glad that some other states, especially those that have tertiary institutions, they are also looking into this and doing this. That I can tell you, because I know quite, especially a state like Kwara is doing something like this also. So we're very glad that this is getting down to the sub-nationals, and that's exactly what we look forward to, that other states and other stakeholders, public sector and the private sector, will do things like this so that we can all collectively cut down on the demand for substance abuse by people, especially our young people.
Indeed, Mr. Babafemi, but realistically, do you think the program has achieved its set purpose? It's one thing to have programs like this, but what are the areas of measuring the success rate, as it were?
Okay, first, we're talking about it now. That is raising awareness. That's one gain on its own. 2, the fact that people know, especially drivers that would have to would have to go through this, they know that if by the time they test positive, they will have to be encouraged to go for treatment. They will have to be discouraged from going on the wheel, from going on the roads. That alone is a deterrent, so that, people will not have to go on the road, on the wheel, behind the wheel, under the influence of illicit substances. That, I can tell you, would also send a message to others. For instance, those that have not even started dealing or experimenting with illicit substances. By the time they know that this program is on in Lagos State, if you have to work in Lagos State, if you have to drive in Lagos State, you have to be careful. And that's why this is also part of the federal initiative, especially the relationship, the partnership between the agency, the NDLA, and the Federal Ministry of Education, as a result of which there is a...
On that note, we'd like to thank you. We know that there's still more to be done. We cannot rest on our oars, but we thank you for your time on the show. Mr. Femi Babafemi, Director, Media and Advocacy, NDLEA. Coming up on Newsday,